Now there are plenty of ligaments holding the liver, and these ligaments are nothing but double folding of the peritoneum. Number one is the falciform ligament, which is a sickle-shaped ligament attached to the anterior abdominal wall and the anterior surface of the liver, and it contains ligamentum teres, which is a remnant of umbilical vein. Second one is coronary ligament. It's called anterior and posterior coronary ligament. They arise from the undersurface of the diaphragm to the superior surface of the liver, demarcating the bare area. The anterior and posterior folds unite to form the triangular ligament on the left and the right lobe. Triangular ligaments, as we said, is right and left triangular ligaments are formed by the union of the coronary ligaments, attaching it to the diaphragm from both the lobes adjacent to the bare area. Coming to the lesser omentum. From the liver to the lesser curvature of the stomach and the first part of the duodenum, this omental fold is called hepatico-gastric or hepatico-duodenal ligaments. And hepatico-duodenal ligament contain the portal triad. Behind the free border of the lesser omentum is a foramen vistlo, which allows for compression of the vessels during a Pringle's maneuver, or may be clamped atraumatically or tourniqueted by passing through the foramen and pars flaccida, which is a transparent portion of the lesser omentum. This is an application of the anatomy. Coming to other ligaments, there are caval ligaments. These are the bridge of broad membranous tissues which are extension of the Gleason's capsule from the caudate and right hepatic lobes. These are of surgical importance as they may contain hepatic tissues including the portal triads and hepatocytes, which may cause bleeding and bile leak if not properly ligated. Now coming to the spaces around the liver. These recesses are anatomical spaces between the liver and the surrounding structures. These are spaces for collection of fluid and abscess formation, which is very important in clinical practice. Subphrenic space, the space between the diaphragm and the liver superior surface, and it is divided by the falciform ligament into right and left subphrenic space. Subhepatic space is between the liver and the transverse mesocolon and its subdivision of supracholic compartment. Morrison's pouch, this is the hepatorenal pouch, and this is the deepest portion of the peritoneum when the patient is lying down, and this is the commonest site for abscess formation. Now coming to the lobes of the liver. Liver's fibrous capsule is called Gleason's capsule. The gross external lobes are right and left. Left lobe, caudate lobe, quadrate lobes. Right lobe is large and the left lobe is smaller when compared to the right. The caudate lobe is located posterior and upper aspect of the visceral surface between the IVC and fossa produced by ligamentum venosum, while quadrate lobe is a lower anterior aspect of the visceral surface between the gallbladder and ligamentum teres. Anatomically, both caudate lobe and quadrate lobes are part of right lobe of the liver. Between these caudate and quadrate lobe is the transverse split called porta hepatis. Now, most important anatomical segments of the liver. Conidard classification of the liver segments has got a huge application in various forms of hepatectomy. There are 8 functional segments. The importance of these segments are each one has its own portal pedicle containing the hepatic artery, portal vein and biliary duct, and each one has got its own hepatic venous branch. It is numbered in a clockwise manner. Caudate lobe is the segment 1 and it is posteriorly placed. Segment 2 and 3 are the anterior and posterior segment of anatomical left lobe. So this is also called left lateral segment and topographic left lobe. Segment 4 is the medial segment of the left lobe. Functional left lobe contains segment 2, 3 and 4. Functional right lobe contains segment 5 to 8. 5 and 8 are the anterior segments, while 6 and 7 are posterior segments.